Hello, this is Ethan Hastert with the 14th District House of Representatives. How are you today?
I'm doing wonderful, thank you.
Today we're going to do interviews with the Voter Education Fair, and that's going to be held on January 17th at the Sauk Valley Community College. So, let's get started. What are your ideas on how to reduce spending in Washington?
Well, I'm in this race because I firmly believe that we're borrowing, taxing, and spending too much at the federal level, and in state capitals across the country. So that's why I'm in this race, to put the brakes on the spending coming out of Washington, D.C. today. Looking back early summer when I filed for this race, they had already announced, the Democratic leadership in Washington had announced that it intended to run a deficit of about $1.5 trillion, and they did that. The 2009 deficit was $1.4 trillion. The projected deficit for 2010 is going to be another $1.4 trillion. When you factor in the simple fact that they're borrowing 50 cents in every dollar of spending in this country at a time when individual families, businesses are cutting back and doing without and trying to make ends meet, it's just wrong. The federal government should live by the same rules that you and I live by. So that's why I got in this race. So there's a couple of things that we can do, in my estimation, to get the budget under control. The first thing we can do is roll back some of the spending items that have come out the door in the past year. We should use the unused stimulus dollars to pay down the debt. Same thing with the TARP dollars. You're looking at two items there that ran a bill of $700 and $800 billion. One was 700, one was 800. So use the unused TARP dollars and the dollars out of the TARP program that have been paid back to pay down the debt. And look at what they're doing today. Right now they're in the U.S. Senate and the House debating a new $1 trillion spending package that's the health care bill. We should, I think, as a country, do other things as opposed to spending more money, throwing more money at problems. So those are the immediate things that we can do. But I'd also, as a representative for the 14th Congressional District, support structural changes that would allow members of Congress and the Congress generally to engage in more sane fiscal practices in a year-in, year-out basis. The first thing that I would like to see is a balanced budget amendment to the U.S. Constitution that would require a balanced budget year in, year out. And the second things I think we can do are common sense earmark reforms to make sure that dollars aren't spent foolishly and provide the president with line item veto authority. But these are some common sense reforms that we can get us back to some sound fiscal practices and get the federal government spending taxpayer dollars wisely again.
Would you favor any legislation that caps federal spending to a % of GDP?
Well, I would favor the constitutional amendment that would require a balanced budget. I think that would be the strongest measure to get back to a balanced budget.
All right, so you do support a balanced budget. What are the positive aspects of our healthcare system today that set it apart from other countries' healthcare systems?
One of the things that I love about getting out and as a candidate for office is getting out and talking to people and hearing about things that they're concerned about and trying to identify problems and identify solutions to those problems. As a matter of fact, this past summer I had the opportunity to travel around the 14th Congressional District and talk to people about, among other things, healthcare. As a matter of fact, I hosted healthcare town halls across the 14th Congressional District, and as a matter of fact, I hosted one here in this very building in Dixon, Illinois. And what I heard from folks were a couple things. First was that we have the greatest healthcare delivery in the world. The problem with our system is it's too expensive. But it's interesting. I had the opportunity to hear from folks who have worked and lived overseas in Europe, in Great Britain, in Canada. Canada not overseas, but has a federalized healthcare system. And their concern, what they told me was that they don't want to see the United States go to a federalized system because they didn't like living under those systems. And as a matter of fact, one gentleman I talked to, when he was living in Canada, would routinely come to the United States for his routine medical care. His concern is that if we match the Canadian system, where's he going to go to get his care? So we have one of the best healthcare systems in the world. Not the best. But like I said, I do believe that, that there are problems, and not the least of which is that access to healthcare is too expensive. But as a result of hosting healthcare town halls and talking to healthcare providers, healthcare consumers, and hospital administrators and insurance providers throughout the district, I've come up with several common sense solutions that will address some of these problems. And I would encourage everyone to go to HastertForCongress.com and check out my healthcare tab on that website, and it goes in depth to a lot of healthcare solutions. But I'll give you a couple today. As a matter of fact, one couple I talked to and heard from at one of the town halls told me that they have a small business and they provide their employees with health care. But they're facing sometimes double-digit annual increases in their premium payments. And it's come to the point where they have to make the choice of cutting back in their head count and certainly not hiring any more people in order to make their health care payments. So, what they've told me is that, especially in Illinois, but across the country, what the government has done is decimated competition. They're limited to a choice of 2 or 3 insurance carriers for providing their health insurance coverage. Now, what they would like to see is more insurance coverage options, more plans from more providers. I think that one solution to that problem is quite simply allowing us as Illinois residents to travel across state lines to purchase our health insurance products. So if there's an innovative insurance product that more matches our lifestyle and our needs, but it happens to be from a provider based in Florida or Indiana or Texas, that we should be able to do that. And that would rely on the free market to inject competition into the system and allow competition to do what it does best: increase quality and hold the line on costs. But you know what? There are a couple of other things. First, I'd like to say that any reform, healthcare reform that I would support, would include robust tort reform. So end junk lawsuits, because when doctors practice defensive medicine, we as consumers pay the costs. But finally, at a time when we as consumers have a vast array of information available to us literally at our fingertips for anywhere from buying cars to electronics, there's no reason that we can't have the same kind of choice and transparency in our healthcare markets that we have when we want to buy, say, a plasma screen TV. It's funny. We in our generation always hear there's an app for that. So I have an app on my phone that allows me to scan a barcode at, say, a bottle of Tylenol or a plasma screen TV, and it'll give me the lowest cost options to purchase that product in the area where I'm physically located or online.
It's handy. I need to get that.
Yeah, it's great. I'll give you the app after we talk here. But the interesting thing is that if we had the same kind of transparency and choice, if we wanted to have rotator cuff surgery as we do